So good afternoon. I'm pleased to be here on behalf of the Joint Task Force, Lee Harris, Mayor of Shelby County. And one of the things we want to talk about today is returning to activity safely. We are always continuously trying to navigate this new normal, and we know that one of the areas is our connection to our faith and to our faith-based institutions. And so we are going to announce the details around a new program to help some of our smaller faith-based institutions to navigate this new normal and to connect again with their members and continue to nourish the important aspects of faith. And so we have two very special guests to comment and give some details around this new program known as our Faithful Comeback. We have Dominique Winfrey, who works in my office at 160 North Main, who will come to the podium shortly. And then after Dominique Winfrey, we'll have the chairman of our esteemed Shelby County Board of Commissioners, Chairman Eddie Jones, to make comments about our program to support our small faith-based institutions. And so with that, I'd invite to the podium Dominique Winfrey to make comment about our Faithful Comeback.
Thank you, Mayor Harris. Thank you to all of our media partners and those watching at home or who are here live with us today. Again, I am Dominique Winfrey, COVID-19 Program Coordinator in the Office of Mayor Lee Harris, and I'm excited to talk about the Our Faithful Comeback grant. Our Faithful Comeback is a grant designed to assist small places of worship with live stream equipment and setup at no cost to the organization. This grant was birthed out of an understanding of what faith means to our community. Since the early 1800s, when Shelby County was founded, faith-based organizations have been a pillar for us. Faith has been a driving force for most in their everyday lives. Many people of faith look forward to interacting with others through weekend services, whether that's a church, a synagogue, a mosque, or any similarly situated organization. And these organizations serve some of our most vulnerable in the community, those being people living in or near poverty, those being immigrants and children, and our seniors. And so faith for many in Shelby County is an essential part of life. What we know is that when COVID-19 hit, many of these organizations graciously closed their doors to help slow the spread of COVID-19. And particularly, many small organizations, those with 100 members or fewer, chose to close their doors to help for safety. No matter how small, whether it's 100 members or fewer, there are people depending on these places of worship for hope and reassurance, which we all know is needed more now than ever. Our community needs an avenue to remain and regain connection with their desired place of worship. But we know that there are challenges, particularly for those that are small faith-based organizations. Through their closure, a lot of the smaller organizations took a huge hit due to lack of technology and resources needed to stay connected to their congregants. Prior to COVID, many of these faith-based organizations depended upon giving from congregants, and according to the National Congressional Study, most small organizations receive between $80 and $100 per member monthly. The leaders of these organizations are often bivocational and make up any financial deficits that their organization may incur. Now, due to COVID, that deficit is even greater due to some leaders losing their jobs, lack of technology, and lack of giving from in-person services. Further, we are 7 months down the road from the initial onset of COVID in Shelby County, and many of these smaller faith-based organizations are still not comfortable opening their doors out of the concern for protection of their seniors. So it is our hope that we are able to assist by offering live stream equipment at no cost to the organization. If an organization has an ability to stream, they are able to communicate that they are open and offer a safe path to worship from the confines of their home. It may also create more space inside of the organizations for those who choose to come. For this grant, we've set aside $150,000 of CARES funding. Those making application can choose between live streaming equipment or $1,500 of reimbursement for PPE. You can apply now at COVID-19.ShelbyCounty.TN under the Our Faithful Comeback Grants tab. For those applying for live stream equipment, you will need to provide identification and proof of nonprofit status. For those applying for the $1,500 PPE reimbursement, you will need to provide identification, proof of nonprofit status, a W-9, and receipts of purchase. If you have any follow-up questions, you can contact me via email at Dominique, DOMINIQUE.Winfrey, WINFREY, at ShelbyCountyTN.gov, or by phone at 901-222-2011. And at this time, I'd like to thank Chairman Jones for all of this support towards this initiative. His partnership and leadership has been a driving force in this project, and we are truly grateful for his support. So I'd like to turn it over now to Chairman Jones.
Thank you, Dominique, for that warm welcome. Here's what I want to say about our faithful comeback. I want to thank Mayor Harris and for him getting involved to make this happen. Being a man of faith myself, I do understand the difficulties that smaller churches are going through, and just want to let them know that if you're listening to this, please apply for this grant, because it is much needed to help you to continue your outreach ministries through virtual learning or PPE, so that if you are meeting, that you're meeting following the health standards that's been put out by the health director. So with that being said, I would simply just ask you to apply if you're faith-based, 100 members or less, so that you can receive a blessing from county government with it to that respect. And so for that, I'm going to turn it over to David and bring him up so that he can fill you in a little more. Thank you.
Thank you, Mr. Chairman. So just to give you an update today on where we are with some of the numbers, we have 34,850 cases that have been reported since March the 5th, and that represents an increase of 342 new cases yesterday. But more also important to note is we've had 841 new cases reported to us in the last 3 days. So over the last 3 days, we've had a 3-day average new case increase of 280 cases per day. We've had 238 people hospitalized with COVID-19 disease in our hospitals as of this morning, with 78 of those people being in the intensive care units of our hospitals. We've had 554 reported deaths so far, and right now we're averaging about 2 COVID deaths per day in Shelby County among our residents. So the important thing to note from these numbers is that, as I mentioned last week, the increase, the fall increase, the surge or the fall wave, however you want to phrase it, of COVID-19 disease has reached Shelby County. And if you are following national trends, you see that it's something that's going on all over the country. Right now, locally, our highest rates per 100,000 population are occurring in Arlington, Millington, East Memphis, the Hickory Hill area, Collierville, and Bartlett. So in all of those communities of our county, that's where transmission seems to be the most active right now. But overall, we're seeing about a 6% test positivity rate. And that's an increase of where we were 14 days ago, where the average test positivity rate was about 5.1%. So all of this is a call to action for us to do everything we can as individuals to slow the spread of COVID-19 disease. And for more comments on that, I'm going to turn it over to Director Alisa Haushalter.
Thank you, David. Good afternoon, everyone. Wanted to make a few additional comments. David spoke specifically to the pandemic locally, and we've also talked about some of the other gating criteria, so I want to just highlight a few of those. Hospital capacity, while we are not at capacity, is being strained. As David noted, our cases for hospitalization are increasing in Shelby County, and that's in part not just because of Shelby County, but what's happening in the rural communities because people will come to Memphis, Shelby County for care. We also know that within our public health system, we have increased our staffing significantly. At this point, we have a few open positions, but really have built up our capacity. But with the increased numbers and the need for increased enforcement, our capacity is also being challenged. We also generally talk about testing capacity. There is still significant testing capacity in Shelby County that's being underutilized. So I want to reinforce our previous messages. If you feel in any way that you need to be tested, reach out for information. You can call and see if there's an appointment available and get tested, and there's no charge for testing. But I also wanted to highlight a few things that are happening in the state of Tennessee. And as David noted, the trends we're seeing are not limited to Shelby County. They're national trends as well as statewide trends. Each week we receive a local report that is what we call the critical indicators statewide, and these are shifting significantly and have been over the last 2 weeks. So Tennessee is now considered in the red zone for cases, which means we have more than 100 cases per 100,000 population in the previous week. That's the 16th highest rate in the country. We also have a positivity rate that's statewide now between 8 and 10%, and that's the 11th highest in the United States. Shelby County, Davidson County, and Knox County are currently accounting for almost a quarter of all cases across the state. Again, this is a local issue, but it's also a statewide issue. It's critical that we do everything that we can to continue the course. We've said this previously, but we are at a very significant moment in time, and that we have to do all that we can within our individual power to reduce transmission. Masking is a critical piece of success. We know that we have mandates locally for masking, but many of you may travel to other states or counties where masks are not mandated. We really encourage you to use masks wherever you go. I use an example. Recently I traveled. I stopped in a rural community to get gas. I was the only person masked within a store, and there was probably 20 to 25 individuals there. But continue to mask even when you leave Shelby County and where it may not be mandated. Continue social distancing, hand washing, and get your flu vaccine. But I also want to remind you of the importance of testing. We have, again, had plenty of testing capacity, but you'll see more information coming out about assurance testing. That's something that's been piloted locally. We think that we're at a place where we can spread and scale assurance testing, which means asymptomatic people get tested frequently based on the type of employment or the location in which they're in. So more to come on that. But a few other key things that we haven't highlighted in a while. It's important to limit gathering sizes. We're not mandating a specific size, but really asking that you consider how many are in a group, and as much as possible limit to those in your household or those within your family or small social circle. I also want to encourage people to exercise your consumer power. We receive a significant number of complaints of businesses and organizations that are not adhering to masking and social distancing, and we are addressing those on a case-by-case basis. But as we know, money talks. And so that use your money, frequent places where you know that those businesses are doing everything they can to mitigate the spread of disease, not only in protecting their customer, but also in protecting their employees. And if there is a business that is not adhering to social distancing and masking, it's okay to let the manager know that that's a place that you may not do business, or you can also report to Shelby TN Health. So we're going to pause there and open it up for questions.
Brad Broders, Local 24.
Yes, thanks, Dr. Haushalter. I know this came out in an email last Wednesday, I believe. Could you, just on camera, though, could you reiterate for the public out there your recommendations regarding fall festivals and Halloween trick-or-treating? And I have a follow-up.
Oh, yes. I'm really glad that you asked that question. I want everyone to know that we have not canceled Halloween. I've received a lot of communications about canceling Halloween, and we have not done that. What we want people to do is make choices for themselves and for their family, and make choices that can reduce the risk of transmission. So I would encourage you to go to Shelby TN Health and look at the criteria that we have, but also you can go to the Centers for Disease Control website. You want to keep gatherings very small. If you choose to trick or treat, you want to keep it really to a family unit and make sure that there's social distancing. For those who are handing out candy, you want to make sure as much as you can that it's individually wrapped and that you're limiting the number of people that touch or handle that. If you choose to have a gathering in your home or in a faith-based community area, you want to limit the number of people who are there and limit the, again, touching and sharing of utensils and other things. Your follow-up?
Yes, thanks. As a follow-up, I know you had just kind of touched on it, but has there been any update on any specific numbers of complaints, business violations in the last couple of over the last week?
So I don't have the exact number in front of me. We receive complaints every day and throughout the day, and those complaints range widely from grocery stores to limited service restaurants. We did receive at least one complaint that I'm aware of someone who attended the football game this weekend that felt in the section that they sat in, people were not adhering to masking and social distancing. So I don't have exact numbers, but again, we're receiving complaints on a very regular basis throughout the day and throughout the weekend.
Kelly Roberts, WMC.
Hey there. So coming off of the report about the White House talking to Governor Lee, saying that there needs to be a statewide mask mandate, and Dr. Haushalter, you talked about your experience in the rural areas. We have DeSoto County where cases are surging and the governor just reissued a mask mandate there. What do you think about, this report coming from the White House? If there was more masking in the rural areas or the areas that surround Shelby County, how does that just benefit Shelby County and the numbers here as well, including hospitalizations, it sounds like, too?
So that's a great question. Clearly, there are not borders that prevent people from moving within the state and from state to state. And as much as our mitigation factors can be at scale, so the more people who are adhering to the mitigation factors, the more that we will reduce transmission. Clearly, elected officials will make choices based on their judgment and their position on critical items, but the more that we have people masking actually across the United States, not limited to the state of Tennessee, the more that we will reduce transmission of COVID, and that will ultimately reduce hospitalizations and deaths. And I think we don't speak to this enough. It's really important to remember that people who experience COVID suffer, and their deaths are very difficult deaths. All deaths are difficult, but they do suffer. And as much as we can reduce suffering in our community, the better off we will be as a broader community. You have follow-up?
And just my second one, speaking of the new restrictions that were put in place in some counties in Mississippi, including DeSoto County, do you feel that, I guess, would there be restrictions here? We talk about that fall wave, any kind of restrictions that might prevent, the fall wave from being larger than maybe predicted?
So we are at a place where individual choice is going to make the difference. And so we really are compelling people to take action at the individual level, because that's going to make a difference. We can do a lot of things that are county-wide, and we've done that previously. But we do know there's transmission in very small social gatherings and within households and within businesses. So we really ask not only individuals and families, but business owners to create safe and healthy environments. We do look at our data, and we have much more granular data on where people have been the 2 weeks prior to when they've become ill or when they were tested. We will continue to look at that data to see if there's anything that emerges that guides us to take action beyond what we are currently doing.
Greg Akers, Memphis Business Journal.
Hi, piggybacking on the previous question, what kind of discussions with the state are you having about masking, based on the recommendation from the White House? Are you also asking them to make such a mandate?
So currently, I am not directly asking the state to issue a mandate. Really, that's been the governor's decision thus far, and those types of requests would generally come from other elected officials. I think our position has been the more people we get masking, the better. We know from the studies that we did in partnership with the University of Memphis that the policy made a difference locally. So we're trying to use evidence to show that the pre-policy locally, we had only 50-something% of people masking, and literally within a week to 10 days, we were over 90% because of that policy. So policies do work. That information is available. We will continue to say publicly, the more people who mask, the more we'll reduce transmission. And your follow-up?
I'm wondering if you've spoken in previous weeks about your models about when the peak may come, depending on certain factors. Do you have any way to determine if there was a statewide mandate or certain variables like that, what that would do to when the peak is and how large it is?
So generally, we're looking at our data at the local level, so we can only predict our own peak. The state looks at statewide data, but I'll turn it over to David to see if he wants to add anything to that.
So thank you for the question. Obviously, we're not modeling data for Tennessee or Mississippi or Arkansas or any of those, but we do monitor the trends in the tri-state area here. And what we know, for instance, is Arkansas last week or just a day or two ago reported the highest number of hospitalizations they've ever had. And as was noted previously by, I don't know which person it was, but somebody noted that the governor of Mississippi reinstituted certain mask mandates in specific counties, including DeSoto. Local data tells us Marshall County, Mississippi is climbing very rapidly in terms of cases. We watch all of these things because all of those counties contribute to our hospital data. And what I can tell you is that Saturday morning we were modeling hospital data and predicting that by mid-November we would have 230 people in the hospital. And then by Monday afternoon, because of the 840 cases and the fact that hospitalizations increased more rapidly, we were already at 238 in the hospital as of Monday night. We weren't predicting to hit that number till mid-November. So what we are very concerned about is that we need to get everybody to recommit to wearing a mask all the time in all the settings when we're not at home. And we've also seen, unfortunately, as was mentioned, business complaints and things that are coming in. We've heard of some business owners taking down the signage that requires people to wear masks. We've got an observational study going on in northern Shelby County right now looking at what is the percentage of people complying with the mask mandate. The mask mandate stays in place, but we can have a mandate. It's not going to do much good if people refuse to voluntarily comply with it. And so we would just challenge everybody to go back to the basic principles. Wash your hands a lot. Use hand sanitizer when you can't wash your hands with soap and water. Wear a mask. Limit your social gatherings and interactions with other people to the smallest size groups that you can. And maintain that 6 feet of social distance between you and other people when you're moving around the world. All of those things that we did so much of during the summer that brought us down from the peak of mid-July, and we drove the reproductive rate of the virus below 1. We can do this. We've done it before. The problem is we've lost our focus. and we need to recommit to these basic principles. And that, if we do that, I do believe we can be successful.
Katie Reardon, WKNO.
Hi there. Yeah, either David or Dr. Haushalter. I was wondering if you could speak to how much hospital capacity, if you have a number, is being used or tapped by surrounding areas.
We cannot at the moment tell you which fraction of the hospitalizations are attributed to people from Shelby County versus the rural regions surrounding us. We know that our hospitals have a broad catchment area that goes well beyond the borders of Shelby County. We have people from as far afield as western Kentucky and southeastern Missouri, eastern Arkansas, northern Mississippi, western Tennessee. So we have a lot of people coming into our hospitals from various areas. But what we do know is that the metro area right here, the ones that these media outlets cover, that the messages we're putting out reaches the core population that comes to our hospitals. And so whether you live in Shelby County, Fayette County, Tipton County, DeSoto, Marshall, Tunica, Tate, Crittenden, wherever you live, if you're getting this message, these basic principles of wearing a mask, washing your hands, limit your gathering size, maintain social distance, all of that is important to you, whether you're our resident or a resident in one of those other counties, because you rely on our hospitals as much as we do.
Yeah, and as a follow-up question, I know that you've spoken to having updated contact tracing software technology. I don't know how you want to phrase it. But being able to more granularly, as you said, pinpoint where infections are coming from. And I'm wondering if you can speak to any trends that you've pulled out of that so far.
Well, we have done some preliminary analysis of some of the first data that was gathered, and we will continue to do that on an ongoing basis. Some of the things that we are seeing is that in recent cases where we've interviewed them, we have people reporting going out to eat in restaurants, people having social gatherings in their homes, attending parties. We also have people talking about employment and employment-related clusters, but it's a wide variety of potential risky settings for transmission that are being reported. It's not one single thing, but we are noting, particularly around employment, that we've seen some increases once again in people who have COVID-19 disease that report working in some sort of healthcare setting, and we need to do some deeper analysis of that right now. But we will continue to analyze this data and look for those points of intervention and leverage, and wherever we can learn something from the data, that's where we will try to make a good decision. Before we wrap up, I want to make sure to invite either the mayor or Director Haushalter up for final comments. I know we have a hard stop at 12:30. Okay, so being asked to remind you to get your flu shot. We do not yet see much of an impact from influenza, but our infectious disease doctors are reporting that the initial flu cases are also being diagnosed right now. I got my flu shot this morning. If you have not yet got a flu shot, we would encourage you to please do that. There's a couple of different reasons for that. Influenza season is coming, and we know that it will have an impact on us, and that will also strain the capacity of our healthcare system. But in addition to that, you can be infected with more than one disease at a time, or more than one virus at a time. And if you have influenza, and then you get COVID-19 at the same time, that can absolutely increase your risk for bad outcomes. So there is no vaccine for COVID-19 disease, but there is an influenza vaccine. So by taking that vaccine, you can actually lower your risk, your individual personal risk of worse outcomes should you also get infected with COVID-19. And it's really an important step to take for your own health and for the health of those you love.
Thanks, everyone.
Thank you.